Brachytherapy may not be advisable for some men. Now, first of all, their cancer may be too big. What I mean by that is brachytherapy really treats just the prostate if you're giving it on its own. So, if there's cancer in which we feel it's likely to have extended outside the capsule, brachytherapy may be inadvisable. Sometimes you can get around that by including some external beam radiation therapy beforehand. But generally speaking, there are some cancers that we think aren't suitable for brachytherapy. There may be things to do with that person's anatomy, if you will, that may make brachytherapy inadvisable. So they may have a very large prostate. By that, I don't mean a large cancer. But what we know is that men, as they get older, can get benign prostate enlargement. And it's just technically difficult if the prostate is large to put the seeds in, to make a long story short. The final thing that may leave us to feel that brachytherapy is not the best thing in that man's situation is if he has significant obstructive urinary symptoms. Now, what I mean by that is this. So, obstructive urinary symptoms would include men finding their stream is really slow, and it's hard to get the stream started. They may not be emptying their bladder fully, things like that. Now, those symptoms don't necessarily mean mechanical obstruction, so what we'll do if somebody tells us about those symptoms, which are most often nothing to do with the cancer, they're to do with age-related benign enlargement, what we'll do, if it hasn't been done already, is recommend to the urologist that a cystoscopy and maybe some other things be done. If you see benign prostate enlargement-related bladder outlet obstruction because of an enlarged prostate, that will leave us to feel that perhaps brachytherapy would be associated with undue risk. So what that means is men can be rendered miserable in the short to intermediate term because of significant bladder side effects and catheters and all sorts of things. Even in the longer term, men with things like that have a higher chance of having permanent sorts of bladder issues too, which aren't great. The last factor that comes into it, which may lead us to believe that brachytherapy isn't the best treatment for that particular case, is if they've had a surgical procedure in the past called a TURP, known also as a TUPR or TUPR. That stands for trans-urethral prostate resection. Most of the time that's done for non-cancer, and it's often done years before. The issue with that is if there's enough of the prostate missing as a function of that procedure, it can be hard to do the brachytherapy implant procedure. Also, there are some risks that go with trying to do an implant, even if you can technically do it in somebody who's had TUPR, TURP before. Now, the other thing that's true is that even if none of those things apply, men can reasonably choose external beam radiation therapy over brachy, or the doctor may choose external beam radiation therapy over brachy. So let's start with that one. The reason doctors may choose that is sometimes men will have some sort of other health condition that might make some sort of an anesthetic inadvisable. So if somebody has terrible heart disease or something, the risk to anesthetic. An anesthetic is required to do a brachytherapy procedure. So we may say, well, I don't think that's going to be a good idea because of the following medical conditions that will mean the anesthetist won't want to give you an anesthetic.